So, hello everybody. Today we'll be discussing what are the effects of different drugs on heart rates and blood pressure. So, in this, we'll be discussing the effect of adrenaline, noradrenaline, isoprenalin, prazosin, propranolol, acetylcholine, atropine, and histamine on heart rate and blood pressure. So, before going to effect of individual drugs on blood pressure, heart rate, just we will see what is the difference receptors that represent the heart and the brains. In the heart, we are having beta 1 adrenal receptors in SA node, AV node, atria, and ventricle. When beta 1 receptors are stimulated in SA node, this results in increase in the heart rate. When they are stimulated in the AV node, there will be increase in the conduction. And when they are stimulated in the ventricles and atrium, there will be increase in the force of contraction. Then cholinergic receptors that are present in the heart are muscarinic receptors. When they are stimulated, again there will be decrease in the heart rate. Their site is mainly in the SA node, AV node, atria, and ventricles. In ventricle, you will be finding few cholinergic receptors as compared to atrium. So when muscarinic receptor is stimulated in the heart, this will result in decrease in the heart rate, decrease in conduction, decrease in the contraction of the heart muscles. Okay. So these are the effects of noradrenaline and acetylcholine on heart. Coming to blood vessels. Blood vessels consist of alpha 1 and beta 2 adrenal receptors and muscarinic cholinereceptors. When alpha 1 receptors are stimulated in the blood vessel, there will be vasoconstriction. And when beta 2 receptors are stimulated, there will be vasodilation. And when muscarinic receptors are stimulated, this results in vasodilation. This vasodilation that is due to stimulation of muscarinic receptor is not direct effect of acetylcholine on muscarinic receptor, but it is indirect effect. It is when muscarinic receptor is stimulated, there will be release of PDRF, antidiuretic relaxing factor, and that results in vasodilation of the blood vessels. Okay. So you can see here, this is normal blood vessel. When you stimulate, when alpha 1 receptors are stimulated, there will be vasoconstriction. When beta 2 receptors are stimulated, there will be vasodilation. This is the effect of noradrenaline. Then when muscarinic receptors are stimulated in the blood vessel, there will be vasodilation. So this is the effect of stimulation of different receptors in the heart and blood vessels. Okay. So now coming to individual drugs. First we will see adrenaline. Adrenaline acts on alpha 1, alpha 2, beta 1 and beta 2 receptors. Okay, it stimulates all these receptors. So due to stimulation of alpha 1 receptors, there will be vasoconstriction. And due to stimulation of beta 2 receptors, there is vasodilation. Okay, so when we give adrenaline, it will be in higher concentration. So alpha 1 receptors are highly sensitive to high concentration of adrenaline. This results in vasoconstriction. And slowly adrenaline gets metabolized, concentration is reduced, then it acts on beta 2 receptors in the blood vessel that results in vasodilation. Beta 2 receptors, they are sensitive to low concentration of adrenaline. So adrenaline gives a biphasic action. Shows a biphasic action. It initially increases the blood pressure, that is through alpha 1 receptor. When its concentration falls, it acts on beta 2 receptor and causes vasodilation, and that results in falling blood pressure. Coming to heart, adrenaline decreases the heart rate. The reason for this is because there is peripheral vasoconstriction. So that results in reflex bradycardia. Any drug that will be causing peripheral vasoconstriction will be causing reflex bradycardia, and drug that will be causing peripheral vasodilation will be causing reflex tachycardia. Coming to next drug, that is noradrenaline. Noradrenaline stimulates alpha 1 and beta 1 receptors. Due to stimulation of alpha 1 receptors, there is vasoconstriction. As a result of which, there is rise in blood pressure. Effect on the heart. Noradrenaline decreases the heart rate. The reason is, again, reflex bradycardia due to peripheral vasoconstriction. So it increases the blood pressure, decreases the heart. Coming to next drug, it is isotretinoin. Isotretinoin stimulates beta 1 and beta 2 receptors. Due to stimulation of beta 2 receptors, there will be vasodilation, fall in blood pressure, and due to stimulation of beta 1 receptors, there will be increase in the heart. So, isotretinoin decreases the blood pressure and increases the heart. Prazosin. Prazosin is a alpha receptor antagonist, blocks the alpha receptors. So, any drug that blocks the alpha receptor, they will be causing vasodilation. As a result of which, there will be fall in blood pressure. And due to peripheral vasodilation, there is increase in the heart rate, reflex tachycardia. This is reflex tachycardia with prazosin. So, prazosin, fall in blood pressure and increase in the heart rate. Coming to propranolol. Propranolol, it blocks both beta 1 and beta 2 receptors. So, due to blockage of beta 1 receptor in the heart, there is decrease in the heart rate, decrease in force of contraction. This results in increase in the this results in decrease in the cardiac output. And due to decrease in the cardiac output, there is fall in blood pressure. Okay. So, propranolol, by blocking beta 1 receptor, decreases the heart rate, decreases the force of contraction, that results in decrease in the cardiac output, and that decreases the blood pressure. You see here, there is decrease in the blood pressure. This is one mechanism. Then, by other mechanism, it blocks the beta 1 receptors in the kidney, that is in the juxtaglomerular apparatus, and decreases the release of renin. And due to decrease of renin, there is decrease in the angiotensin 2 levels. And you know that angiotensin 2 is a potent vasoconstrictor agent. So, due to decrease in angiotensin 2, there will be vasodilation. Again, this results in fall in blood pressure. Then, as it is decreasing angiotensin 2 levels, there is decreased formation of angiotensin 3. Angiotensin 3 is mainly responsible for the release of aldosterone that causes sodium and water retention. So, there will be decrease in the sodium and water retention. This will lead to decrease in the blood volume, and that will decrease the blood pressure. This is the third mechanism. Fourth mechanism is it directly blocks the beta receptors in the CNS. As a result of which, there is decrease in the sympathetic discharge, that again decreases the blood pressure. These are the four mechanisms by which propranolol reduces the blood pressure. Coming to acetylcholine, it stimulates the muscarinic receptors in the blood vessels, so that results in release of EDRF. EDRF causes vasodilation, and that results in decrease in the blood pressure. Acetylcholine on the heart, it stimulates the muscarinic receptors, and that results in decrease in the heart rate, bradycardia. So, acetylcholine decreases the blood pressure and also decreases the heart. Coming to next step, that is atropine. Atropine, it blocks the muscarinic receptors in the blood vessels. There is no effect on the blood pressure because acetylcholine does not directly decrease the blood pressure. That's why atropine does not affect the blood pressure. But atropine, by blocking the muscarinic receptor in the SNO, it increases the heart rate, tachycardia. It causes tachycardia. Coming to next drug, histamine. Histamine acts on the histamine receptors in the blood vessel and causes vasodilation. As a result of which, there is fall in blood pressure. And due to vasodilation, there is reflex tachycardia. Histamine decreases the blood pressure, increases the heart rate. So these are the effect of important drugs on the heart rate and blood pressure. I hope you have understood. Thank you very much.